COPD stands for chronic obstructive pulmonary disease. Let's break it down. Chronic describes how it doesn't go away. Obstructive describes the way it makes breathing difficult, and the pulmonary disease means it affects the lungs. Around the world, COPD is becoming more common. It's now the third highest cause of all deaths. The true number of people with COPD is likely to be much higher, as many people don't know they have the condition. An early diagnosis is important so that the treatment can be started to slow down the damage to the lungs. As you can see from this picture, the early signs of COPD is ongoing cough and mucus production. Most of the time, smoking is cause of COPD, as particles from smoke inflame and irritate the lungs. So stop smoking is the best thing smoker can do. However, COPD does occur in non-smokers too. Polluted environments and rare genetic diseases can also lead to COPD. But what exactly is COPD? First, let's see how the lungs works. The lungs are a spongy network of airways and air sacs. When we breathe in, air travels down the branching airways, which become smaller and smaller, ending up in tiny air sacs. In these air sacs, oxygen from the air moves into the blood and carbon dioxide moves out. In COPD, inflammation over time causes permanent damage to the airways and the air sacs of the lungs. The airways become swollen and filled with mucus, obstructing the flow of air. The air sacs lose their structure and sponginess, so they can fill and empty as easily, making the exchange of oxygen and carbon dioxide difficult. These lung changes cause the key symptoms of COPD: breathlessness, wheeze, cough, and phlegm. The symptoms worsen over time, making daily activities harder. You should see your doctor if you have these symptoms, as early treatment of COPD can make a big difference. So, how is COPD diagnosed and treated? After checking your symptoms, doctor can arrange breathing tests to see how hard and how fast you can blow out air from your lungs. If you are found to have COPD, doctors will recommend the most approachable treatment to help with your symptoms and control the disease. For smokers, stop smoking is the single and most effective thing to do. Inhalers, which comes in many forms, will be started and contain medicine which help expand the airways and reduce inflammation. Using an inhaler can be difficult, but correct technique is essential for the medicine to be effective. Also, people with COPD should get vaccinations to help prevent chest infection and regular checkups to see how overall treatment is working. Treatment may be stepped up according to your needs, and other medication may be prescribed as well. As the earlier treatment given, the less likely symptoms will get worse. Antibiotics and steroids are often used, and sometimes oxygen therapy is needed. In severe cases, a stay in hospital may be required, but in milder cases, treatment can be given effectively at home. We don't have enough sources to know how COPD have an impact on COVID-19. But as we know, COPD affects the air sac structure, which makes harder to breathe. Also, COVID-19 affects the alveoli walls. If we think an alveoli, which is already get damaged by COPD, there is a really low chance of living if you get COVID-19. because COVID-19 makes the patient hard to breathe, and the patient probably gonna end up by ventilated. According to Chinese documents, COPD have a death rate of 6.3%. In this video, we learn about COPD, how it affects our lives, and how it got treated. Thank you for watching my video. I hope you guys didn't get bored, because I try not to be. Stay safe, stay healthy.